Hey guys, welcome back to First Class Convo. It is Cindy here, and today we're going to be talking about something that I have been questioned about lately. I have had a few people come up to me and say, "Hey Cindy, you look like you're losing a little weight. What you doing, girl?" And so I told them I have actually been taking the injection called Wegovy. As you know, or you may not know, that my YouTube channel actually started back in 2019 when I had actually lost 100 pounds. And I lost 100 pounds due to having weight loss surgery. At the time when I had it, I was about 264 pounds. And the lowest that I got was about 160 pounds. And I was content being 160 pounds. But life happened to me. And I started back some of those old habits because, after all, weight loss surgery and anything as it relates to weight loss is just a tool, and you have to work your tool. If you don't work your tool, then your tool will not work for you after a period of time. So, if you know me, you know that when I find something new that works for me, I love to share it with people. I don't gatekeep. I don't like to hold things back. I like to be forthcoming and tell you the truth and be an open book and be very, very transparent. So, back in January, my coworker and I were talking, and she was telling me about this weight loss drug that she had been taking, and she told me how much weight she had lost. And at the time, I was really suffering with my knee. I could tell when I gain weight, I can always feel it in my knee first. Before I see it in my face, I can feel it in this knee. And some of you may or may not know, my right knee is bone on bone, and I need to have a knee replacement. The reason why I have put it off is because it's going to cost me about 3K out of my pocket to have the weight loss surgery, and I
I
have
meant
insurance,
knee
very good
replacement surgery,
insurance at
not
that.
weight loss surgery.
But this doctor that I have is saying that that's how much it's going to cost me out of pocket. That's another story. We'll come back and talk about that on another episode. But needless to say, when I gain weight, I always feel it in my knee. And so I went to the doctor. I was also told that I was back to being pre-diabetic. I'm like, okay. So I went to the gym and I started working out. I changed my diet, and I didn't see any change. I felt like I literally had to starve myself to see some weight loss. So um, I said I gave the gym a run. I think I went to the gym consistently for about 2 months, and I probably only lost about 4 pounds. So I was not into starving myself to lose weight. So I finished having that conversation with my friend about what she had did to lose weight. And so I went to my doctor and I asked them to prescribe me Wegovy. And that's what they did. I want to start by saying this. I am in no way a healthcare professional. I'm not a doctor, I'm not a nurse. I am just a patient who has taken this medication and it has worked for me. Am I suggesting that you take it? No. I am recommending that it is a good drug that worked for me, and it may be something you may want to consider, but I am in no way a healthcare professional. So, what is Wegovy, you ask? Well, Wegovy is a GLP-1 injection that is taken weekly. It has a generic name called, which I can never say it right, semaglutide. And Wegovy is not the only one. I believe Manjaro has the same medication, and possibly Ozempic, but don't quote me on this because, like I said, I am not a doctor or a pharmacist or a nurse or any of that. But this medication is only for weight loss. Now, it will help if you are diabetic, hence why it's helped me from no longer being pre diabetic. Well, you say, well, Cindy, okay, you've told me What this medication is, what it does, it actually helps you lose weight over a period of time. Now let's get into the dosages. So within the first month, you'll start off at the lowest dose, which is 0.25 milligrams. You'll take each one of these doses for 4 weeks. Month 2, you'll move on to zero point 0.5 milligrams. Month 3, you'll move on to 1 milligram. Month 4, you'll move on to 1.7 milligrams. Month 5, you'll move on to 2.4 milligrams. Now, at any point you want, you don't have to keep progressing going up. If you get to a dose that works for you and you want to stay there, by all means, stay there. But I noticed with every one of these doses, because the 0.25 is really just the initiation dose, it's your starter dose to see how your body is going to react. Now, when I say that, I'm basically saying that there are some side effects with this medication, which could be nausea, diarrhea, vomiting, constipation, stomach pain, headaches, tiredness, upset stomach, dizziness, feeling bloated, belching, gas, stomach flu, heartburn, runny nose, and sore throat. Those are some of the side effects. Well, you say, well, what side effects did you have, Cindy? I'm glad you asked. My side effects have been very minimal. I'm grateful for that. The main side effects that I had was every now and then I would feel a little bit of dizziness, nausea, if you will. But it comes on so fast and goes away so fast. By the time I realize I have it, it's gone away. But the main one that stuck around was the constipation. I had the constipation really, really bad in the starting doses. And I'm so glad that went away. But just keep in mind that you can take things that won't cause you to be constipated, which I had to find that out later. A lot of the information I found out was from other people or just doing research. It wasn't the information that my doctor gave me. Um, Another side effect that I had that I now experience, and it may be too much information for some, but you know me, I'm going to be transparent. I don't gatekeep. I'm willing to be open and transparent with you. So, that other side effect that I now experience is diarrhea. I notice now that on the dose that I'm currently on, when I take my injection immediately within 24 hours, I'm guaranteed to have diarrhea. So your next question may be, well, Cindy, are your side effects so dire that you would not recommend this? No, that is not the case. What I would suggest that you do is that you research this medication, see, read and see all of the side effects that it has. You know your body. You know what may work for you and what may not. If you take the starting dosages and it does not, and it makes you feel horribly bad, then discontinue it. Find something else that may work for you. But from my experience, none of my side effects were bad enough for me not recommend this medication. For me, Wegovy comes highly recommended. For me, it does. So you may ask me, Cindy, well, if you would have found Wegovy before you had your weight loss surgery, would you have had weight loss surgery? Absolutely not. I would not have had weight loss surgery if I would have known about Wegovy first. It probably was around, but I don't know if my insurance would have covered it at that time. So yes, I would have definitely chosen Wegovy over weight loss surgery. And the main reason why is because I would not have had to go through having a surgery, because weight loss surgery is a major surgery. I had the gastric sleeve. They removed 80% of my stomach. So that's the reason why I would suggest Wegovy over having the weight loss surgery. But again, everybody's body is different. Now, again, so the side effects that I gave you are just the minor side effects. Now, of course, there are some major side effects that Wegovy can cause. I have not experienced any of them. My friend who was taking it did not experience any of these major side effects. So, the major side effects are inflammation of the pancreas, gallbladder problems, increased risk of low blood
That should
pressure,
say
kidney
increased risk of low
problems,
blood sugar.
serious allergic reactions, change in your vision in people who have type 2 diabetes, increased heart rate, depression, or thoughts of suicide. That has not been my story at all. I have never experienced any of those major side effects. I do also know that people who have had thyroid issues or pancreas or kidney issues, your doctor will not prescribe Wegovy to you because it may cause those issues to increase, I guess. So, yeah, if you've had those issues, then you're not a candidate for Wegovy. There was another thing that I forgot to tell you guys about Wegovy is that one way that it helps you lose weight is you're not eating as often or as much as you were previously eating. What it does is it slows down your intestines from the food moving so fast through your intestines. Hence the reason why you get constipated because your intestines aren't moving as fast as they would normally move. Um, your stomach isn't emptying as fast and your intestines aren't emptying as fast. So you're staying full longer. Also, this medication helps you to not think about what you're going to eat next. And that's one thing I love about it. I have somebody that I know and love dearly. I always say, "Oh, what you gonna eat? What you gonna eat?" And I'm like, I haven't thought about eating. And I didn't really realize that so much until I started taking Wegovy, that it does this thing with your mind. And I don't mean that like it makes you think you're crazy or anything like that. No, that's not what I'm saying. It really does help you not focus so much on food. Um, I even saw that there was a study that because of Wegovy, because of what it kind of does to some of your how it stimulates your brain, that they were going to start using it for dementia patients. Just something that I saw. Again, I'm not a doctor, I'm not a nurse, I'm not a health care provider in any way, shape, form, or fashion. I'll also go on record to say that Wegovy is just like any other maintenance medication. My plan is to back down my dosage. I have one pen left of the 2.4 milligrams. I've actually been on the 2.4 milligrams probably for about 2 months. But I'll say this, I was taking the 2.4 milligram and I stopped taking it after 1 week and I put myself back down to 1.7 milligram. The reason why is because I have what's called restless leg syndrome. And I noticed that that first week of me taking the 2.4 milligrams is that restless leg syndrome increased. So I went back down to 1.7 milligrams for 4 weeks. I finished it. Then I went back up to 2.4 milligrams. I will be honest and tell you that I do still feel the restless leg syndrome. I'm feeling it far more frequently than I was before I went up to this 2.4 milligram. So my plan is to take my last pen next week of the 2.4 milligram and decrease my dosage and allow it to become a maintenance medication for me and go back down to 1.7 milligrams What I didn't tell you guys previously, that with Wegovy, after my doctor prescribed it, was that I had to get a prior authorization through my insurance for Wegovy. So, excuse me, after about a week of being prescribed the medication was when I was actually began. Well, I won't say begin it. I actually got it and picked it up from my pharmacist because once you're prescribed Wegovy, depending on your insurance, you may need a prior authorization. And then your pharmacy may take a few days before they actually get it because it's not a medication that they keep on hand. So I got it and I held on to that medication for a few days before I took it because to be honest, I was scared to inject myself with it. So when I did inject myself with my first pen, I didn't do any research on how the injection should go. And so I ended up wasting the first pen. So it was probably about a month and a half after I started seeing weight loss on Wegovy. Or maybe even more than a month and a half, maybe 2 months. Because keep in mind, that first month is just a starter dose of getting the medication in your system to see how well you tolerate it before you begin to move up to the next dosage. So moving up to the next dosage, I had went to the doctor and I had a doctor appointment for something I can't remember. I think they wanted to check my blood to see if I had lost any weight, also to see if it was actually working, to see if it was lowering my blood sugar levels, my A1Cs and things of that nature, and it actually was. So I actually spoke with one of the patients there at the doctor's, not the patient, she was actually an employee of the doctor's office. And she saw that I was on Wegovy and she told me that she was taking Manjaro. And I asked her, I said, well, how is it working for you? She's like, well, to be honest with you, Miss Cindy, it's really just a tool. If you don't do what you need to do, you're not going to lose the weight. And that's when the bulb went off. Wow, here it is. I have another tool that I'm not allowing to be used to its full potential because at that time I really wasn't going to the gym like I really should have been. And so I kind of started going more frequently, and then I started seeing more weight loss. But then I actually had an event to occur in my life where I actually had to go and pick my granddaughter up from school every day. And so I couldn't go to the gym and I didn't want to go to the gym late at night. So I kind of backed down on my exercising. Needless to say, I did lose the weight. Right now, I have lost about close to 50 pounds. I think I'm about 4 pounds away from having 50 pounds lost. I am totally content. I do not want to go any lower. I really want to get down to about 170, 2 pounds away from 170. And when I get down to that, I'm done losing weight. Like I said, after this next pen, I'm going to lower my dose and allow it to become a maintenance medication. I wanted to talk more about it being a maintenance medication because just like you have your high blood pressure medication, your diabetes medication, your cholesterol medication, those are all maintenance drugs. And we know that obesity, it is a disease. Just like all of those other diseases, they have a maintenance medication. So why can we not have a maintenance medication for obesity? And that's what I'm going to allow it to be for me. Just a maintenance drug. And if I go down to the 1.7 and I'm still losing weight, guess what I'm going to do? I'm going to go back down to the 0.75 because I do not want to continue to lose weight. I want to maintain my weight. And at some point, I may even try to get off of it and see how well I tolerate it without having the tool at all. If that works for me, then I will come back and share it with you guys. But just know, regardless, I'm going to share my journey with you because you guys are the ones who helped to encourage me in the past, and I expect it to be the same way now. Thank you guys for listening to my TED Talk about Wegovy. I'm Cindy, and this is First Class Convo. I'll see you guys next time.